We've been preparing for the winter season since last summer. We are starting to see slight improvements.
Santé Québec, the province's new crown corporation for the health network, held its first press conference since it came into effect last month. They provided an update Friday morning on the situation in hospitals across the province as some ERs in Montreal grappled with occupancy rates of around 200%. According to Index Santé, as of 10 a.m. Friday, the average stretcher occupancy in the city was 146%. The Jewish General Hospital topped the list at 221%, while the Lakeshore General was at 200% capacity. It's a common occurrence at this time of year as respiratory viruses and influenza cases increase pressure on the system.
We know that on January 1st, there's an increase in terms of the occupancy. We've all known that for years, and this might not disappear right now, but what can we do to every year get even better to the last year before?
Santé Québec says the situation improved during the holidays when the average stretcher occupancy rate in Quebec was 106%. Frédéric Abergel, the Executive Vice President of Operations and Transformation at Santé Québec, told reporters there's been a 24% increase in the availability of primary care appointments.
We want to move from a crisis situation to an ongoing improvement approach also, because every slight improvement in some emergency might help also other emergencies, but they might not be the same otherwise. But it's not something that we can solve right away.
He says Santé Québec has been preparing for this since July.
Having the whole Quebec healthcare network prepared 6 months in advance was a new thing also for us. So we are learning from that. In the next few weeks, we will do some kind of lessons learned to make sure that next summer we do prepare even better.
He says 44% of visits to the ER are not urgent.
We need to understand, why do some patients still go to the ER? Is it because they tried to call their family doctor and it wasn't available? Did they think of calling the doctor?
The Crown Corporation asks Quebecers to avoid ERs in non-urgent cases by calling 811 or going to pharmacies, clinics, or CLSCs. In Montreal, Alyssia Rubertucci, City News.